Hey everybody, welcome back to Sweat and Iron. I'm Graham, your host, and I am bringing to you a long overdue episode. That's right, we are back with more episodes, and all I have to say is I am so sorry for the big break, but you know what? I'm a one-man show, and I just needed a mental break from so many different things that I just decided I'm gonna just I cut off social media for the most part. I cut off podcasting, and I cut off so many other things, and just centered on family and work because work just took up so much of my time. So just know this: there are many more episodes coming, and I am trying to line up so many more down the road. So if you are listening to this, I am back at it. I am wanting you. If you're listening to the show, I want you. I'll talk to you about whatever you want. I've decided, you know what, as long as I can link it back to health and fitness and whatever else around that area, I'll talk about it. But we're going to go off on tangents. We're going to go off on this. We're going to go off on that. But for today's episode, I am bringing to you an interview I did with my friend Jaime, who I met through my wife, Connie. And I get into how they know each other, how they met, and how we met. And she's into, she is a physical therapist and a damn good one, and she knows her stuff, and she's been at it for quite a while, and she's married to a power lifter. So we get into a little bit of physical therapy. We get into talking about stretching. We get into talking about injuries. We get into so many different things that I might as well just let you get into the interview. But needless to say, talking to Jaime opened up my mind to so many different concepts and understanding why we do what we do when we work out so that we don't have so much crap happen to us down the road. Because as you'll find out in this episode, generally it's one thing that you slack off on that leads to other things getting screwed up, and the big picture gets narrowed down to one thing that you could have generally worked on the most, and then that leads to a whole bunch of other problems. So, amazing. So without further ado, enjoy the show. How's the baby?
Good, yeah. I think he's getting some teeth. He's been a little fussy off and on.
Drooling?
Oh, yeah. Yeah. And then just like not eating off and on. He always eats good at daycare, but at home it's kind of hit or miss.
Oh, and yeah, we noticed that the eating tends to stop when the teeth start coming in, because then they're just like, nah, I don't want to do it.
Yeah. Unless it's something super soft, he's like, yeah, that's not worth it.
How old is he now?
He'll be 2 in July, so like 21 months or so. Yeah.
Man, time flies.
I know. I can't believe he's going to be 2.
But between working and having 2 kids of our own, it's just time just flew.
Mm-hmm. Yep.
Garrett just turned 3. Callie will be turning. Wait, his birthday is in July. What day again?
July 19th.
That's okay.
Were you guys close?
Yeah, because Callie's is the 21st. So
oh wow,
yeah. I remember it was around that time. I just couldn't remember how close. It's just so wonky because my dad's birthday is the 20th. Eric, Connie's brother, is the 20th. My father-in-law is the 13th. Your son's the 19th.
July's. Yeah.
A lot of July birthdays.
Yeah, I don't think we have anybody really super close, like family-wise, that's in July.
Here, so. it tends to be July and November. Those are like those are the big birthday months.
Yeah, we got February and September. Those are the big ones for ours.
It
Yeah, that's weird.
is weird. All right. So, you're in physical therapy. You're a physical therapist.
Yep.
Jamie is here, and she is a friend of my wife's, and you guys have known each other since Bradley.
Yes, yeah. So I'm trying to think of how long that's been.
Well, I mean, I graduated in '07. Did you guys graduate in '07 too?
Yeah, so '07 and then yeah, so I've been a PT for almost 10 years, so it's been over 10 years, even probably more like 15.
PT. Yeah, I noticed that a lot of people don't call it physical therapy anymore. It's just PT. Um,
Yeah, it's hard when it's like at work it's like PT and we have physical therapy assistants, so it's just so much easier just to say the PT or PTA.
oh, PT. Wait, so what's the difference? They're one and the same?
Physical therapists actually now have, well, not all of them, but now when we graduate, it's a doctorate in physical therapy.
Hmm.
And then the physical therapy assistant is associates in physical therapy. And so they actually like don't learn as much about like diagnosis of like what their actual problem is with the patient. They just kind of follow out what we find and what we tell them to kind of work on.
I gotcha. So it's almost like back in the day, LPN, RN
Hmm.
sort of thing.
And I kind of compare it a little bit to people like, when you work with your doctor, sometimes now there's a physician assistant.
Correct.
It's a little, I mean, it's definitely on a different level, but it's kind of on that scale of things.
Yeah, because the physician assistant only goes to med school for X amount of time, whereas the doctor goes for the entire full
Mhm.
amount that's required.
Yeah. And they
That's
actually have to work under a doctor. I mean, they're still seeing patients on their own, but they are technically with a doctor.
right. Doctors got to sign off on everything.
Yeah. Yep.
Whereas you guys, do you, do you guys, well, how about this? You tell me what is it that you guys do particularly? Because when I think of physical therapy, I think you're just working all you do. It, don't take this the wrong way. It's because
Mhm.
I know of physical therapy. I've seen physical therapists at work, and I've made the mistake of walking up to somebody thinking they're a nurse, and and they said they were a physical therapist, and I was like, oh well. I didn't know physical therapists wore scrubs. I thought you guys wore like
Mhm.
business casual gear. And so, what I think is you guys work one on one with the patients on mobility and flexibility and stuff like that.
Mhm.
Is there more to it than that?
Yeah, I mean, in the outpatient world, yeah. I mean, I actually did do work in the hospital as a physical therapist for a while, so I can comment a little bit on that. And in the hospital, I definitely found it easier to wear scrubs. So, and so it definitely was easy to get confused with nursing. So I didn't mind that so much. It was just more of like when the doctors always asked us to help out with something, I was like, yeah, I can't really do that because I'm not a nurse.
Hmm.
But so on, anyways, but in the hospital, it's more like working on getting the patient back to their mobility level, especially to make sure they're either ready to go home or trying to get them close to going home. So it's a lot more of just working on their strength and a little bit of their flexibility, and especially if somebody's been in bed for so long, they definitely will have to work on a lot of those things, and just making sure they're safe with their balance to be able to get home. But so in the outpatient world, it's definitely on a higher level. It's definitely their mobility, getting a patient back to their mobility, but it's a little more specific to certain tasks. If it's shoulder pain, they may not be able to, fasten their seatbelt because they can't, reach across. So if they have a lot of pain, we'll do some things for pain control, such as kind of help, we manually stretch the patients and move their joints, and that can help with their pain. And then we can have the patient do some exercises that are going to be related to those things that also help their pain, and then eventually work on their mobility and their strength, and get back to doing those things that they can't do anymore, that they weren't able to do. So.
But you guys don't write any prescriptions or anything. That's all doctor, PA,
Yeah.
APN.
Yeah, definitely no prescriptions. I mean, in a way for like medications or X-rays or MRIs,
Uh-huh.
it's more of just recommendations for exercises, and so I don't really like truly call it a prescription. It's their prescription that, in our way of thinking about it, it is, but not really in most people's way of thinking of it, of a prescription. So.
Okay. That makes total sense. Now, how about you go to school to be a physical therapist. What does that entail? I'm gonna just guess that you have a lot of anatomy and physiology.
Yeah, yeah, because you have to do undergrad, um, which is a bachelor's, and then that's typically, um, I don't know, it's kind of like kinesiology, but it doesn't really have to be kinesiology, but it's going to be those type of classes. So the biology, chemistry, and physics, but then you have to still do anatomy and physiology, and then you also do it again in grad school. And even in grad school, we do anatomy in so much detail that most grad schools now actually we have cadaver labs. So we
Oh,
actually get
cool.
to, it definitely helps finding like, 3D wise where everything is and where the muscles all attach. And that gives you a better idea and then you actually have to go and be, tested off on all those things and memorize how the muscles are supplied with the nerves and which, what they perform and then where they lay in order to know, how to work the muscle the best. So,
So you're basically building upon everything you learned in undergrad.
in more
More and more
detail
and
a
more and
little
more and
bit, and
more
then
and
just
more.
like memorizing it way better.
Yeah, yeah. If there's one thing that I excelled at, I remember I aced the bone exam, but for some weird ass reason, I sucked at when the muscles and everything. I don't know. I found anatomy and physiology boring at the time, but now that I'm more into working out and everything and understanding what muscle does what, I'm pretty sure I would do a lot better. But I wasn't. I'm one of those people that I have to really be interested in the subject in order to excel at it. Otherwise, I just get by with a C. But
Yeah, I was kind of undergrad. I was like that part of biology, the anatomy and physiology, but the I don't know, just the plant-based, science and all
oh
that stuff,
god,
DNA. I was
botany
just
and
like, oh.
yeah, genetics. Oh my god, I hated genetics. He had to deal with fruit flies. I remember the
Mhm.
fruit fly lab. The fruit fly lab. Oh my gosh, I hated being in there. It was so stupid. The fruit flies were everywhere. Um, but so the cadaver lab. So does that mean that the bodies were all intact, or did they have some bodies that they had cut open to show you all the muscles and when the body moves and stuff like that? Or tell me a little bit more about that.
Yeah, we actually, they were actually the whole body, and we actually had to dissect it ourselves. So we
No
had about
way.
groups of four, I think about four people. So it was all summer, I think like 2.5 months, twice a week for a couple hours. We were in there going over, working on different body parts. And then after we would go over a body part, our teacher would put little flags on different parts, and then we would have to walk around each one and identify it that was our test each whatever section that we did.
So it was like
So
a pin with a flag on it, and he'd just be
yep.
like,
hmm
"Here, here."
Then a
The,
number, and then we just wrote down the number and what we thought it was.
the disturbing part of my brain is wanting to know how old were the bodies, like fresh, like were they a few
Oh,
weeks old or what?
they were pretty, yeah, and they do formaldehyde, so
Mhm.
they don't decompose because of the formaldehyde. So
Gotcha.
it doesn't get yucky, but it smells majorly like formaldehyde.
Oh,
So
sure, yeah,
pretty
yeah,
sure my anatomy book still smells like formaldehyde. So
yeah. I'm so used to that smell from being in the lab that it's just one
mhm.
of those things. You smell it and you're
Yeah,
just
you
like,
definitely get used to it if you've been like at the end of the summer it was like nothing, but like now sometimes I grab my lab book out and I was like, oh, that's a, a memory that comes back to me every time.
yeah, my dad told me a story about when he was at U of I. He took an A&P class. He said he took it for shits and giggles. He signed up for it, and there was a in the cadaver lab. the lid, there was a canister, or it looked like a trash can, but it had a lid on it that was labeled heads. And then he said that the trash can had another lid that didn't have a label on it, or maybe it did. I can't remember. I definitely remember the one that for heads said heads on it, cadaver heads. So one day he came in and he switched the lids because the containers looked the same. The lids were labeled differently, and he put his lunch in the garbage can, would put the head lid on it. And so when he came in, at the end of class, as he was walking out, he grabbed his lunch, and everybody was just like, "Oh my God, Paul, what are you doing?" Funny little story.
That's good.
Yeah, I told that at work the other day, and everybody was just, they said the same thing. They just kind of frowned at me, and I was just like, "You guys don't find that funny? It's it's very stupid and funny at the same time." But
Yeah, yeah.
okay, so you put little flags on them, you dissect them yourself. That's like taking the whole dissect the frog thing to the next level. That's pretty badass. Did you have any
Mhm.
queasy people in your class that you were just
Just a
like,
little bit, yeah. I mean, not queasy, just more of like, I mean, we did cover up the heads. Sometimes we didn't really want to stare at their faces really the whole
okay,
time.
I
And
could guess that would get a little weird after a
yeah,
while.
and I mean, once you got going, it kind of didn't really resemble a body in a way. So then you didn't really think about it too much. So
Yeah, when I go in the gross room for our lab, they'll have legs, they'll have whatever
mm,
skulls, and they're just, take out. You could always tell when they've got a ligament, some sort of appendage that has a bone in it, because the bone saw gets turned on. You don't even have to be in the room; you can hear it through the doors. And but I've gone in there and they've just had, a leg with a foot there, and the weird thing about it is, you think to yourself first, you're like, wow, it's somebody's leg and foot, it's below the knee. And then you look at it and you're like, that can't be real, that doesn't look real,
yeah,
it looks very fake. But then they start cutting it up and you're like, oh no, that's definitely real. But it's, I don't know, to me, the first time I saw somebody's foot laying on a counter, it looked like a prop from a play. But
yeah.
I guess that's one of those things that after a while of going in and out of the gross room, which of course the gross room is part of histology, where they basically hack up the body parts and make slides for the pathologists to review for tumors and whatnot that they want to see what's going on. But
Hmm.
anyways, going back to you, yeah, I could see, covering up the head, that would definitely make you get used to, oh, okay, this is no problem now.
Hmm.
Wow, that's, back in college before I got into lab, I didn't think that that'd be something I'd want to see. But after doing, my job for so long and hearing you talk about that, I kind of wish I could go to a cadaver lab just to check it out. I wouldn't really want to do anything. I just want to
Hmm.
just see how, the class does their thing. It'd be crazy. Anyways, so moving on, after you got out of school, what did you first start doing?
Yeah, I actually started at inpatient physical therapy, and I think I always knew I wanted to do outpatient, but I was able to start, working for a company that I, wanted to work for. So I knew they worked towards, providing, better patient care and trying to get the current evidence to the therapist and helping them provide better care. So I ended up starting inpatient, which was actually probably good. It's a good, review of like the whole medical system and, when to be careful about certain things. And then also did some patients there outpatient a little bit at the hospital that were a little bit more neuro diagnosis, so like strokes and multiple sclerosis and Parkinson's. And so again, if we get some patients who are mostly orthopedic now, at least I can kind of refer back to my couple years of experience doing that if they have some other symptoms that I'm concerned about. So
Wow, that had to have been rough dealing with those kinds of diseases.
yeah, it was rewarding in a way just because sometimes, I mean, I like helping people when they hurt and making them feel better, but it was kind of nice sometimes to not always be dealing with somebody complaining about pain.
True. Okay. Yeah.
So
Yeah.
So just working more specifically on how I can help them do something better versus I just want to feel better, and nowadays people are pretty big on trying, being pain is pretty a big focus in like nowadays and with our country. So I definitely want to make people feel better, but it's hard and frustrating because sometimes pain can be confused with, or soreness can be confused with pain. And sometimes pain is not a bad thing. It just shows us that we need to do something differently. And, it's just hard to teach people, habits they've learned for
Correct.
years, or things that they've learned for years that aren't necessarily correct. So,
Yeah, that's actually a good thing that you brought that up, because it seems to me one of the common misconceptions of when you start going to the gym is, oh, I hurt myself, I pulled something. Oh, but they're just really tender muscles because they're muscles they haven't used in probably a long ass time or ever. And I just feel like that's one big misconception when people start going to the gym. And the other thing is, you're right. The one of the biggest problems that our nation has right now is the painkiller. Would you say epidemic?
mhm.
It's a big problem, and the microscope really it is no longer a microscope. It's a macroscope, I guess you could say, and in a sense that the NFL really blew it up once they were under examination for abuse of painkillers. Then you got wrestling; they abuse painkillers, and then it just blew up. Bodybuilding in general, painkillers, painkillers, painkillers. You got so many bodybuilders out there in the world that or power lifters that lifted so heavy they pushed the limits and they wound up blowing out discs. They wound up tearing ligaments, doing this, doing that, destroying their back, and they get hooked on Norco. They get hooked on. Um, can't really say Vicodin anymore because they kind of got that off the market, right? And it's
Mhm.
you got Norco and
Percocet,
oh yeah, Percocet, and then there's not morphine.
fentanyl, but that's not as common.
There's fentanyl, yeah, but there's also hydromorphone. Well, yeah, there, all that stuff, all the all the C3, C2,
Yeah.
all that stuff. The stuff that stays in the locked cabinet.
Mhm.
But yeah, that seems to be a big issue right now. So, how do you, as a physical therapist, disseminate how do you tell the difference between somebody who has real pain and somebody who just is sore?
Yeah. So I usually ask them maybe like, when did the symptoms start? Um, if it was maybe right after we did something, like immediately, I would say maybe that was more pain versus that 1 to 3 days after and got better after a couple days, would be more muscle soreness. And then, asking them where it was, because typically their pain was maybe in one spot. And if they're trying to tell me it's like in a little bit different spot and
Mhm.
it's described differently, then it's probably more muscle soreness, especially if it got better after a couple days. So,
Gotcha. So timing
and
is the big
yeah.
thing.
And if they kept doing the exercises that I told them to do and it still got better after a few days, then um, definitely it was probably more soreness. So,
Okay, so it's really not a simple. Oh, it's definitely pain. Oh, it's soreness. You really have to. You have to wait it out a few days and kind of do like um, a bunch of questions in a row of, did you do this? If yes, then we move on to this next step. If no, then we move on to this, that kind of thing, like kind of like a tier thing where you move down the next tier of where we at. That's how I'm imagining in my head. It's
mhm.
like, okay, did we do the 3 days and you're still hurting? Yep. Okay, then did we try this? Yep. Okay, then it's definitely pain. But have you ever come across people who they are lying, I guess?
Probably rare. Um, I always feel like we can see and that somebody maybe isn't moving right.
Mm-hmm.
And if it's out of proportion, disproportionate to their pain, it's how they rate it, and like a lot of their symptoms maybe don't add up, um, and there may be some ulterior motives,
Okay.
that they might benefit from not getting better. Otherwise, some people just maybe aren't ready necessarily. Not that they don't want to get better, it's more that they are not ready to hear that they need to actually just move to get better. They're not ready to hear. People kind of get stuck on a diagnosis and they need that diagnosis to be fixed. And typically, tissues heal. So, their tissues may heal and then they have some sort of sensitivity in their nervous system. And those people tend to get put in that category that they're not
I see.
legit, but they actually have some pain. And it's more of a not an actual tissue issue, and it's more that they're sensitive. Their nervous system is extra sensitive, and so any activity is going to cause some sort of pain.
The other thing is, I mean, after asking you the question and hearing your answer, the majority of the people that are seekers, is what you would call them, would mainly be going to the ED anyways, or some outpatient care setting where it would be, like an immediate care thing, rather than going all the way to physical therapy and talking to you. By the time they get there, that means that they've already jumped through a whole bunch of hoops, right? And now they're there with you, and that means that they've already taken that step to they want to get better, which means they really have a
Mhm.
problem, or they're more than likely have a problem that they want solved rather than the pain pills.
Mhm.
Um,
Yeah,
that's
they're
why
ready to try something else. I don't know if they're always ready to be told that they need to actually like move to get better.
right, right. Um, how many sports injuries have you dealt with in your career so far?
Um, I would say not as many as I would like because I feel like, there are things now we do actually have what's called direct access, meaning patients don't have to have a referral anymore to see us. Um, However, most insurance companies are still requiring it for payment. So I think sometimes by the time they see the doctor, they've done a lot of other tests and treatments, and maybe time they've already gotten better. I feel like we probably could have gotten them better quicker, but they've already spent more time with all these tests and
Oh wow,
other treatments that maybe I feel like we should probably be seeing them more. So,
that
but
gives
we
a good time reference, because when I'm hearing you say is, well, let me give you an example. I've pulled my groin. I have gotten tendonitis in my knees, and both injuries. Well, the groin muscle got better after 8 to 10 weeks. My knees, on the other hand, took a little bit longer because I'm constantly using my knees, to walk around, get up out of the chair, go up and down stairs, even though I finally gave in to just using elevators all the time. It made me feel old, but I did it. And because I like to stay active, I want to use I want to climb stairs. Anyways, that took a while. And what I'm hearing you say is that means that these people could go anywhere from 8 weeks to 3 months. And by the time it's even a chance to be physical therapy, they're feeling better. They don't need it anymore. That's bananas.
hmm yeah, I mean, and then we get the people that have the recurring issues, which is fine. It just has had more time to develop bad habits that we'll work on. It'll just maybe take a little bit longer and more sessions versus if I saw somebody that, I mean, if it's a week out and they're mostly better, it's probably not something that we really need to help with. But if it's, going on a week or two, if we saw people for just 1 or 2 sessions, we could probably show them what, to do better, especially
Sure.
if it's bad enough that they feel they need to see their doctor. I feel like they should
Mhm.
probably just come to us first. So,
Now, for all the listeners out there that are tuning in, Jamie is married to quite the man. His name is Laramie, and
mhm,
he lifts weights and he makes it look good, I must say.
yeah.
He's a power lifter, And the gym that he works out at, all his videos, whenever I see him, it looks like a classic old iron gym that it does not look like an Anytime Fitness. It does not look like Lifetime Fitness. It looks like somebody's gym in a garage. I'm not sure where he works out at. Is that somewhere down in Normal, or is that in
It's in
Peoria?
Bloomington. Yeah.
It's in Bloomington.
Yeah. Yeah. It's pretty much, I'd say it's like a really just large garage gym.
I had a feeling that was the case. Yeah, but I mean, it's cool. The guy has like flags and stuff hanging from the wall, or these huge. I don't know what they are, but they look cool. But anyways, yeah, he lifts weights, and I can't help but think that he has quite the hookup. I mean, he's married to a physical therapist, so I mean, he's got the instant. Hey, I got this going on. What do you think I should do? And on the one hand, I know that Laramie can be well, unless he's changed. I know that he can be stubborn, but and he loves to talk. So how is it being married to a man like him and being a physical therapist? Does he listen to your advice? Does he take your advice?
Yeah. They always tell us you don't treat your family members because they really don't listen to you. So, um, I would say yes, he does listen, not as much as I probably would like, but enough to where I feel like it's like at least somewhat helpful. Does that
Uh-huh.
make sense? Like,
Oh, it does. And you
and I
said
feel like if I'm going to explain something, I'm like, I'll just give you the information, and if you want to do anything with it, you can.
yeah,
So,
yeah, yeah, and listening meaning like he's actually looking at you while you're talking to him, right? And
oh yeah,
it's like
yeah,
going in his head, because sometimes my wife will be talking to me and I am not looking at her, and that means that I'm not listening. It's not that
yeah,
I'm ignoring her, it's just my eyes are centered on something else. And I do it all the time when I'm at work. My coworkers give me crap. I'll be at lunch and I'll be on my phone, and they're in the middle of having a conversation right around me. And then somebody asks me a question about what I thought about it, and I'll be like, I have no idea what you just said. What did you just say?
yeah,
And it's not that I'm being rude. It's just I thought the conversation had nothing to do with me.
yeah,
Back to your point. It's because he's a man. He's your husband, and it's a common thing in the man genes that we sometimes, don't listen because we don't want
yeah. And I think it's just too like your family members don't really quite know what you do necessarily unless they do it themselves. Like I just and so like I think unless and it's not like it's different when I have a patient come to me because it's I've had patients on the second visit like who are really like talkative and friendly be like, oh, you're actually like really friendly, but like on the first visit it's kind of down to business and like I mean we chit chat, but I have a lot of information I want to get, and I don't really do like a formal evaluation on necessarily on like my family members, so it doesn't
to.
become that formal, and maybe that's where it kind of loses a little bit of the effectiveness.
Well, that's because you're not
So
at work. You're not at work. You're at home. You're with your family. You're more
yeah,
relaxed with them,
yeah,
and you don't want to push anything on them either, right? You don't
yeah.
want to.
It's a little bit different, yeah, and how you explain things to a patient and emphasize it, and they're there to see you versus your family's just asking you for advice versus like you're the professional at work and they will probably be a little more likely to listen to you just because of that.
It's got to be a little difficult. I mean, it's difficult for me because at work it's easy. Everybody understands the language. Everybody you work
Mhm.
with, they know the lingo, and the patients. I mean, not that I deal with patients, but I would imagine with you, patients taking more seriously, like you said, because you're there, you're in your work outfit, you're in your work attire, and they're just like, oh wow, she's the physical therapist, she knows everything. And when you're at home, you're just viewed as mommy, and
Yeah,
well, now you're
yeah,
mommy, you're the
yep,
mommy of two boys practically, but
yep.
um, yeah, I totally understand what you mean. With me, my problem on the other hand is I work in a hospital, which I mean you did too. I mean you're outpatient, but you were in a hospital, right? Or
Mhm. Yep,
you've done both.
yeah. Mhm.
And so then you've got family members who see, oh, he works in a hospital. He knows doctors, he knows nurses, he knows how to diagnose patients. So then I get, and because they know I work in a lab, they think, okay, I had this test done. Doesn't mean I have cancer. I'm just like, What did you have done? I had a CBC and a CMP, and they said my platelets were a little low. I'm just like, that doesn't mean anything. And they're just like, so I don't have cancer? I said, I didn't say that. Just, this is irrelevant information. This blood work looks normal. You need other tests in order to figure out what you're asking.
Yeah.
But yeah, I get that all the time. Mostly my grandmother, because she's older and she loves me very much. I like to think, well, I know that's true, but I like to think that she thinks that I'm like some superhero. But it gets a little annoying every once in a while when that happens, because now my mom does it. The older she gets, the worse it gets. But I mean, it did feel empowering a little bit when my mom was going through her when she was diagnosed with cancer. I was like the go-to person for her. My doctor said I need to do this. What do you think? And then all of a sudden I'm just like, well, I really don't know the answer to that, but I'm really glad you asked me. I could tell you who you should talk to. So I mean, at least in that aspect, you and I mean, we at least know how to get people in touch with the right people, or know who they should be talking to as far as professionals. So that feels really good. I think that's the nice thing about our job, is we've got good networking opportunities for that. But yeah, getting back to, I kind of went off on a tangent, but what I'm trying to say is, it's just, I kind of envy him in a way. I mean, I do, but I'm married to Superwoman already. So, I mean, you know how awesome Connie is. Just imagine if you were a man married to her and she had 2 kids and she was able to do like everything and anything, which she does every day. Although some days she wants to take the day off and I tell her, no, you cannot. No,
You're too good at it.
You're too good at it. Don't do it. Do you feel that way yet? Do you feel like you're super mom yet?
Yeah, a little bit. Yeah. Like, I just think about like being able to work and still, spend time at home, and you find ways to make shortcuts that that are not important, that way you can spend time with everybody else. So, and find little ways to be efficient. So,
speaking of Superwoman, Connie has a question for you.
Yep.
All right. This is related to your profession. If a person is, let's see, if I'm trying to figure out how she's asking this. I'm just going to read off how she has it. If I am listing, I don't know if that's a typo. If I start having back pain, how do you troubleshoot the decision to just take it easy for me versus going to the doctor? Lifting. If I'm lifting and start having back pain, how do you troubleshoot the decision to take it easy or go to the doctor?
Yeah, and take it easy is important nowadays, to realize that doesn't mean bed rest anymore. So I like to emphasize that with some people, because that used to be one of the recommendations. So, but take it easy, maybe just don't do anything extra strenuous and try to hold off on that exercise for a while. And then if it's the only thing we would have screened for, if you're concerned, is if your pain is, radiating into your legs and it's getting worse and you're having numbness and tingling or weakness in your legs, or any changes with your bowel or bladder. But otherwise, anybody else, I would say probably rest for a few days, and then if your pain gets better, you could try it again, but maybe with less weight. And if you still keep having issues, then ideally you would probably see a physical therapist, but your insurance might require you to see a doctor first. So maybe you could, but you might be able to still go see a physical therapist, and then they could, talk to your doctor if they think you need, any other treatments or tests done.
Yeah, that's kind of the answer that my doctor gave me. It took me a long time to find a doctor who was good for me. I don't know how else to put it. I was raised by my parents took me to this doctor that I had ever since I was a little kid, and every time I got sick, he would always give me an antibiotic, and I didn't think anything of it until I got older. I got into college, and my allergist pointed out, you have been over medicated. You don't have sinus infections. You just have really bad allergies, and then you happen to come down with colds around the same time. And I'm just like, oh, well, that's great. So then I cut him loose and I went on to a different doctor. And then I didn't like him because he kind of just did whatever I wanted him to do, which then I was just like, no, that's not good. So then I found this guy who was recommended to me by my boss, and I go in and he asks me what's wrong, and he tells me straight up, whether I like the answer or not, what it is. And that's the kind of doctor that I need, and that's the kind of doctor I want, and that kind of doctor is good for me, because I went in with the groin pain, as I told you, and his answer to me was, I need you to stop lifting for 6 to 8 weeks. And I'm like, what do you mean stop lifting? He goes, just stop leg day. You could work your arms, work your upper body, do whatever else you want. Just don't do anything with your legs for 6 to 8 weeks. And maybe go on the bike a little bit, but do some stretching, do this, and tell me how you're feeling after 6 to 8 weeks. And it was the best advice he'd ever given me, because I still stayed active. I just didn't do anything lifting wise down below. And then with the knee problem, it was sort of the same thing. I mean, he basically told me, he's like, just don't lift, same answer, but it all worked itself out. But I mean, I couldn't agree more with bed rest per se. You said that used to be the go-to answer. Now, when you say that, how long ago was that? Are we talking 20 years ago, 15 years ago?
Probably recently even, there's still some times that people think that. I would say maybe within the last 5 years. It's probably, been shown before that, probably 10 years. But it takes time for evidence to get pushed, so probably at least the last 5 years. It's definitely more known not to do bed rest for sure.
Is that one of those things where the evidence gets pushed, gets published, doctors go to a convention, they learn something, and then they come back and start having the patients do different things?
Yeah.
That seems
And
to be
maybe 1 or 2 doctors hear it, and then it takes time for them to spread the word to do, for everybody. So
yeah, at work, one of the common jokes is when a doctor starts ordering a test quite frequently that nobody else orders, we always joke around saying that doctor went to a convention. He must have gone to a convention recently.
Yeah. Yep. Especially if it's the only one. They're the only one.
Yeah. They went to a convention in Hawaii or something where not that many people go. Okay, so that's let's see. How about so she said, how about listing knee pain, not one pain. Oh, same for knee pain. How about knee pain? She said, what about knee pain? How do you go around, not that you're diagnosing, because you don't diagnose, right? Or do you?
Well, not officially. We don't really diagnose, and I don't really mind, because it's not usually just one thing. There's probably one source of tissue that's maybe causing the pain itself, but there's a lot of issues that are contributing to that, such as maybe the weak hip, is causing somebody to rotate their thigh in with, squatting, and so then their knee puts more strain on the patella tendon, and so maybe it's the tendon. So we wouldn't diagnose it as like a patellar tendonitis, but we could, in our minds be thinking that's probably the source of the pain. So, my diagnosis would just be knee pain, consistent with potential tendonitis. So, so yeah, I guess it depends on if it was like a repetitive, it keeps happening. If it keeps happening, it's more likely that you probably are going to need to take a longer break. If it's just one time, maybe there was something else that you did that contributed to it. Maybe you had a busy day doing yard work and then you went and lifted, and so that combination of the two, made it more sore. So if you keep lifting and then resting and lifting and resting, and then it's not getting better, that's definitely when you would probably need to, get in and get it looked at so somebody can figure out why it keeps happening.
It's amazing how our bodies are like a puzzle. It's not just one quick answer.
Yep.
And that's what's so cool about your job. Your
Yep.
job is really to think about, okay, you're having trouble here. How can we fix that? We could try moving this over here and seeing if it improves. Let's do this for a few days. And then while we're doing that, we can move this one over here. Do you do multiple areas at once depending on the recovery that's happening, or do you try to focus on one area, or how do you do?
Um,
Or is it case by
if it,
case?
yeah, if they're in that stage where it's just really irritated and painful, we'll probably give it one or two things, is the ideal, because really just to help with the pain. And if you give too many things, you're not going to know what's helping it.
Mm-hmm.
And then if you get towards the phase where they're really not in a lot of pain, but you're trying to like address all their areas of weakness that are probably contributing to it to keep it from recurring,
Yeah.
we might be able to give, a little bit more at that point. So
Okay.
trying to stay manageable though, because we know people aren't going to do it if we give them 20 exercises, and really you don't need to. You can find the higher level exercises that the patient can do to work those muscles the best. So
Gotcha. All right. So, a big question that I have that I'm going to be asking you, and then I'm going to be asking my buddy Matt, who is in episode 1. He's going to be coming back for another interview here shortly. But I'm going to ask him this very same question because I like to tease him because he's the master personal trainer. He's like the highest level of being a personal trainer right now, so he has to know everything. And
mhm.
so if I get the physical therapy aspect, I can then be like, so what is your opinion? Um, what is your take on stretching? Because there are some people that stretch, there are some people who don't stretch. And it seems to me like the younger you are, the more you can bounce right into working out without stretching. The older you are, the more you got to stretch before you work out. Would it be something that you should always be doing, or what is your take on that? Because I don't know, it just boggles my mind.
Mhm. Yeah, I if like anybody has any questions, I can look up specific research. I just don't know it off the top of my head, but because I really like to try to stay with the current evidence. But if how things work are when you're exercising, um, you're gonna want your muscles to have mobility. So I usually typically recommend to patients to do more of a dynamic stretching before exercise. So
Mm-hmm.
um, it's not like a static hold. You're just moving your legs or arms in the direction that you're gonna be moving with, especially with, or at least at least in the way that you're going to be moving with an exercise. So like a runner, there, the marching in place, butt kicks, because you're going to need to bring your thigh up and your leg back in those ranges. So those types of dynamic stretching probably before exercise, but then in general to have flexibility is important. So doing static stretching is going to be important, especially for an area that you really have a lot of limited mobility in.
Mm-hmm.
Although anybody that has more flexibility is probably going to be better off. So ideally, I'm probably stretching everywhere would be beneficial for anybody.
Sure.
Um, and
That's fine.
then those are the main recommendations. So warm up with dynamic stretching and then static stretching afterwards, or just in general after you're kind of warmed up somehow. So
What is your take on foam rollers? Do you have to use them for physical therapy at all?
yeah, I mean, if I can have them use that and it actually like improves their symptoms, that's definitely something I would have them try. I don't know if there's a lot of evidence out there yet to support it, but I use it to maybe help hold a muscle down too in a
Mm-hmm.
tight area and then stretch it. So I kind of call it like a pin and stretch, because the muscle is sometimes really long, and if you can hold it down in one spot, where especially where you feel like that knot or that tightness, and then work into your stretch, sometimes that's another way to do it. So I don't really know quite where that fits in, but definitely it is a way to improve your mobility. So
Yeah, I only ask, and I'm not asking for a professional physical therapy outlook. I guess it's just I wanted your personal opinion more than
Hmm.
anything, because in the personal training world, they're all about foam rollers. And
Hmm.
whenever you get on Facebook, everybody's like, well, you got to use a foam roller after you work out, after you lift. It helps release all the whatever, it helps work out that muscle after you've really
Hmm.
worked it hard. And, some people say it works for them. Some people say it doesn't. And then other people say they like the really hard foam rollers. Other people like the softer ones and stuff like that. So
Hmm.
do you find personally that is it personal preference for the most part, or because you said that there's not much, and I agree with you, there's not much research out there that really backs
Yeah.
foam rollers. It's all, from what I can gather, it's personal preference.
Yeah, and I mean, there really maybe just hasn't been a lot of studies done. So it's not to throw it out, to say that it's not important. So it's hard to, like, for physical therapy, we tend to focus on things that have more research, but I don't like throwing out things that don't have research. It just probably means that maybe it just hasn't been studied yet.
Hmm.
I feel like it's a little bit newer, so we haven't had a chance to get a like high quality studies yet anyway. So I like to use it, especially on a few areas. Like, I'm not one to just go and roll every area, but some of the areas that I find that I get really tight, I'm more likely to foam roll those areas. And probably, like, if it's so tender that it's bruising, I would say you could probably use a softer foam roller, but
Hmm.
otherwise, whatever would be your preference for how it feels would be,
Okay.
that's what I like. Yep.
Nice. Well, Jamie, that wraps up this. That's all I got, really. That's all I can
Okay.
think of. Stick around for just a second.
Okay.
And to everybody out there, thanks for tuning in, and keep setting your goals, and you keep at it.